the whole lack of diversity in our professors and our teachers. I mean, it's something that has affected me this entire I guess my entire educational career. There was a time in our class, like the past couple of weeks actually, where we were talking about race modifiers that were put on, I think it was lung function or something along those lines. I was asking why we use that if the rest of everything else is supposedly so individual. And the explanation was kind of what you always hear. It's like, oh, well, like these people generally have this or these people generally have that. And it didn't make sense. And so I pushed back on that again. And I was talking about how race is like a social construct and how can we apply that to, how can we apply that to this biological measure that would, I guess, in the end affect somebody's care. And I mean, the response to that was it's just like kind of what has been like found in all the research. And one of the examples that she gave was that the exact like the EGFR measure, which is, I mean, a lot of hospitals have already dropped. So in the first place, it was a bad example because hospitals have already kind of realized that that's putting people in danger. But it's like situations like that where I wish there were, I guess, other people on that level that could have backed me up in the situation, or that could even help create that kind of change on a wider level, or at least um, inform people that it's an outdated kind of piece of medicine.
Diversity in medicine is important for so many reasons. It's important because a 5-year-old boy who wants to pursue medicine needs to see physicians who look like him to show him that he can, in fact, pursue his dreams. It's important because a medical student, like myself, needs to see physicians who look like them to tell them that they do belong in medicine and that medicine is a space that is accommodating for them. Physicians need to see physicians who look like them to show them that they are supported and that this is a space where they belong. Patients who come into a hospital distraught need to see doctors who look like them to say, oh, their experiences on the team are represented. Diversity in medicine is important for so many reasons. And so it's really important that we consider ways to increase the number of underrepresented minorities in medicine and push policies that not only get them there, but give them a seat at the table.
Diversity in medicine is incredibly important because we can't hope to serve a diverse patient population, which is inevitable if we don't have a physician workforce that is representative of those who we hope to serve. So that's diversity, ethnic, sexual and gender orientation, religious, geographic, and all of the above. So incredibly important.
We're doctors. We're given special rights and privileges by society. They let us prescribe drugs. They let us be involved in some of the most intimate and hardest moments of people's lives. And all of these like privileges are hinged and contingent on the idea that society trusts that when people come to the hospital or they go to their primary care doctor and they sit in that chair, we think that you have their best interests at heart. And if we know that the lack of diversity right now is driving negative health outcomes for populations, then it's our moral duty, I think, as clinicians to correct it. And to correct it, it means, yes, working with middle schoolers and high schoolers to get them into STEM programs that will support them, and then also getting people into undergraduate programs that will support them as they try to get to medical school. Like myself, I was part of the Posse Foundation, which is like a national scholarship program for urban high school students that help support people as they get to college so that they can make it to the next step. And I don't think I'd be at HMS. I actually know that I wouldn't like have ever even applied to HMS if Posse hadn't been there for me since my senior year of high school. That story, or like my story, can't continue to be the exception to the rule, right? Like here at HMS, like we need to be making sure that the high school students in Roxbury and Dorchester are having the same opportunities, and that they are represented in the class and end up becoming clinicians just as often as kids from Newton are. So uh, it's a lot of things. I think it's racial diversity, it's ethnic diversity, and it's also socioeconomic diversity. Or like, yeah, you could check all of the identity boxes on the outside, but there's still something to be said about understanding the lived experience of growing up poor that a lot of people don't get, and we need doctors who understand how being poor changes your worldview and the decisions that you make. We can't call ourselves doctors if we continue to let monolithic healthcare workforce serve as a barrier to entry for patients to get the care they need.